let this be a brief addition to the clip I just made on the public option. I forgot to mention that there are two factors that are important in creating robust primary care, and robust primary care is the nexus or the basis or the pivot point of the practice of medicine. The practice of medicine rests on the shoulders of properly practiced primary care medicine. And my gripe with primary care medicine is that there are no more office procedures. But in the employment of the government, the government would have the right to create a job description for primary care doctors, and therefore would include office procedures, an extensive array of office procedures that these doctors not possibly do in private practice today for fear of litigation, of hearing a litigating attorney say, doctor, when did you get your boards in surgery, or when did you get your boards in urology? In other words, this doctor can't afford to sew up a wound if there happens to be a secondary infection. There can be some litigation, and believe it or not, all you have to do in too many cases is suggest that we're going to have a lawsuit, and a little settlement for $2,000 or $3,000 occurs, and the doctor's malpractice insurance goes up. So the advantages now of a public option, which is public, which is an option, the advantage of these to the entire medical system is that it creates robust primary care, because the primary care doctor is protected from litigation by the FTCA, and also expands the scope of his practice so that the number of referrals to specialists are drastically reduced. They don't have to be. Why refer to a surgeon an ingrown toenail that can be taken care of in your office? So hundreds of billions of dollars can be saved annually. And as I said in the other clip, in addition, emergency rooms would be decongested, and all citizens would have robust primary care available if they needed a splinter to be taken out. I mean, it sounds frivolous, but that's about where we are. To get a splinter out, you don't go to your primary care doctor today, unless you just feel, unless you want to take it out at home, because that would be better than going to your primary care doctor and being referred to a surgeon. Okay, but I think those are the important points to remember. In the public option, in this particular case, the primary care doctor would be liberated because fear of litigation would be reduced, and the patients would be liberated because they could get a lot of care at these primary care centers. All right, thank you very much.